Imagine yourself sick. You and your family don't have money to pay for whatever illness you have. If not, in the middle of a natural disaster or military conflict, your house is in shambles, you have nowhere to go. The only thing you have is the skin of your back and the clothes that you have. What would you do? This is a large reality for a lot of people throughout the world today. There are many people all over the world who are in these type of situations and have no one to turn to, either because they have no money to look for help, or their government doesn't care much about them. Upon research, I found upon research of these issues, I have found that an institution or organization rather called Doctors Without Borders helps these people. The problem: a large amount of people throughout the world have these issues, whether it be sickness, natural disasters, or armed conflict. People suffer all over the world suffer from sicknesses such as dengue, malaria, HIV, AIDS, cholera, tuberculosis, all, all, all illnesses that can either be prevented or easily treated. According to advert.org, International HIV/AIDS Charity, 68% of the people who are living with HIV live in sub-Saharan Africa, 12 in East, South, and Southeast Asia, and from then on the numbers dwindle. These are the highest percentage of people living with HIV and AIDS, those two continents alone. Natural disasters such as floods, earthquakes, and cyclones affect the world globally. According to the World Health Organization, an earthquake of 8.4 magnitude hit Sumatra region of Republic of Indonesia, September 12, 2007. 4 people died, 7 people were injured, and close to 620 homes were destroyed. Where did all those people go? They had no money left, their houses were destroyed. Armed conflict. There are many armed conflicts going on as we speak at this moment. The examples are the Democratic Republic of Congo, Haiti, Nigeria, Northern Iraq, Iran, and Jordan. People are uprooted from their homes and left without anything, just because of the military. According to the UN Development Program, 4 million Colombians have been displaced due to international violence and conflict, mostly because of drug cartels that are operating in these countries, and the people are just innocent bystanders, uprooted from their homes with nothing left. But these people can be helped. They don't have to be left on their own. The help that can make these people's lives easier or simple. Sickness. People These people need proper medical treatment or medicine to cure the relative symptoms and education on how to prevent further spread of the symptoms. Most of these illnesses I've mentioned can be either treated easily or just prevented altogether. Such as tuberculosis, malaria, measles, and mumps, and HIV, which can be treated. Natural disaster and armed conflict. The victims of these situations just need shelter and food, and a safe place to take care of their kids, where they can grow up and make a living on their own. The same issue with medical treatment. If they're injured they're innocent bystanders. If they're injured, they should be entitled to medical treatment or surgery if needed, and first aid. You're probably asking who or what group of people would offer these services to the people who are in need. Doctors Without Borders, the answer. It is a humanitarian organization, privately owned, not influenced by any government or political powers. In an article retrieved from Academic Research Complete Database titled Humanitarian Space and Social Imaginary Medicine Sinks from Terrors, Doctors Without Borders and Without Borders and the Rhetoric for Global Community. The author goes on to specify this organization and its humanitarian views. James Orbansky, a member of the organization, quotes, places influence on humanitarian morality that while not neutral in this convictions is nonetheless said to be independent from any taint of political influence, though, meaning that the organization has not been influenced by any political agendas only on their humanitarian beliefs. An example of this is in North Korea. In 1998, the organization had to withdraw from the humanitarian effort there because the government was influencing the individuals who were participating in helping these people and messing up with their agenda. The services this institution provides, it provides treatment for people with HIV and AIDS patients. Natural disasters, an example, the earthquake I mentioned earlier. On September 12, 2007, they sent 3 teams of logisticians, doctors, nurses, psychiatrists, along with 230 tons of relief materials to that region alone. Armed conflict. In the example I mentioned earlier about Colombia, they sent psychologists to talk to kids to try to ease their life after the traumatic influences they've seen. They also have various clinic treatment centers to treat victims of physical harm or psychological harm, which have they become of it. How is an independent organization able to provide such a treatment to the patients at little to no cost to them at all? In conclusion, the organization isn't founded by any government or country at all. It's privately owned and survives merely on the corporation's sponsors and donations that it receives. You heard you heard the organization. I just spoke to you about how the organization has affected the lives of many people in the world. The organization would be grateful to any of us in this classroom who would donate to it. If you donate, any amount of money will be used to help care for a person directly and would help their lives be much easier. You can put a person in a home or shelter for a while. Treat a sick person who can't afford it. So in this holiday season, when we're getting our presents and gifts, you can send the people in need a gift of a meal, medicine, or even maybe another day of life.